Okay, hi Lisa. Do
Hi David.
you want to introduce yourself?
Yeah, so my name's Lisa Maddox and I'm one of the adult nursing lecturers at the University of Derby.
Do you want to tell us a little bit about your career?
Yeah, so I trained from 2003 till 2006 in Birmingham at Birmingham City University, but it was UCE back then. And then when I qualified, went straight to work in A&E in Birmingham, where I stayed for about 4 or 5 years before going off to work in the Faculty of Education within the Trust, and then moved from there to Burton Hospital as a resource officer. Stayed there for about 18 months, decided I missed A&E and went back. And then after having my second child, I carried on working permanent nights in A&E for a while, and then once she started school I went to train as a health visitor in Sandwell, and then worked as a health visitor in Birmingham, and then I came to the University of Derby in March last year, so I've been there just over a year now as a lecturer.
Brilliant. So can you tell us about a patient or a clinical story that you'll never forget?
Yeah, it's a funny one.
Good.
So while I was working in A&E, a colleague who I will not name because she may see this, and I were looking after a very, very sick patient that needed to be transferred out to another hospital because we hadn't got any intensive care beds. So we're getting ready to transfer the patient, and we started collecting all his belongings together to send with him to the hospital. And she picked up the patient's underwear from the floor, which wasn't in the best state. It was rather large and white and very grubby, and tucked it into the sleeve of the patient's jacket that was hanging over the bed. Put it onto the trolley with the patient, and he was transferred off to this other hospital, accompanied by an anaesthetist. So we carried on cleaning up the cubicle where the patient had been, and in walks the anaesthetist, having transferred the patient with the pumps and the monitors and everything to return them, with the jacket that had been hanging over the bed over his arm. So my colleague had tucked this not very clean underwear into the sleeve of the anaesthetist's jacket.
Brilliant. Was it still there?
As far as we know, it was still there. He didn't mention it. I did try and encourage my colleague to tell him, but she wouldn't. And we were just laughing too hard to be able to actually tell him anyway. So yeah, that's gone down in history in that A&E department as being one of those things. Yeah.
Okay, so what's been your favourite job?
I think probably A&E has got to be. I mean, obviously I returned after leaving because I missed it that much, and I think it's about the teamwork in A&E. I don't think, although I've worked with some great teams in other places, I think because you go through such highly emotive situations in A&E, you develop a kind of bond with the people that you work with, and it becomes more like a family. And of all the things that I miss most since leaving A&E, I think the thing that I miss most is the people I worked with. So I think that was probably my favourite job.
Okay. And if you weren't a nurse, what would you be doing?
I think I'd either be a holistic therapist. I am actually qualified as an aromatherapy massage therapist as well. So I think either holistic therapy or I think I'd have gone into teaching probably, and maybe being a SENCO, a special educational needs coordinator in schools, because that's something else that I'm really passionate about.
Yeah. Okay. Do you have any hobbies outside of work?
So I've just taken up running.
Okay.
I'm not a runner. I've never been a runner, but I've just taken up running. I'm actually really, really enjoying it. And I also do karate as well, twice a week, which I only started fairly recently. My son's been doing it for years now, and he's almost up to black belt. He's just a couple of belts of black belt. And then I decided to take it up last year. So yeah, I do karate as well.
Fantastic. Have you got any pets?
Yes, I've got a cat. He's over here somewhere. He's asleep just next to me. I've got a black cat called Richmond, after the cupboard goth in the IT Crowd, if anybody's watched that. It's an old fielding character in the IT Crowd. So he's called Richmond after him, not after the sausages, which is what we usually get at. And he's very bitey.
Bitey.
Yes, he bites and scratches an awful lot. He's not a very friendly cat, but he's asleep next to me. He likes me, but I think that's because I feed him cheese.
That's just a reason to like people in general, though, isn't it? Because they feed you cheese. Yeah. Have you got any messages for our students?
I think obviously at the moment in the current situation, I think the students have done exceptionally well to adapt and to stay engaged and to carry on being engaged. I think that stands them in really, really good stead for their future career as nurses. So I think just to keep that attitude that they've had over the last couple of months and carry on with that into their careers as well.
Brilliant. Thanks, Lisa. Thanks for talking to me. Thanks for answering the questions that the students set. See you soon.
Thank you. Bye.